Okay. Welcome everyone to the Tobacco-Free RNAO webinar, Run to Quit, the Effectiveness of Physical Activity as a Smoking Cessation Technique. My name is Nicole Jeffrey. I'm an Implementation Specialist for the Tobacco Intervention Initiative at RNAO, and I'll be moderating today's webinar. RNAO is a professional association for nurses in Ontario and promotes excellence in nursing practice and advancing nurses' contribution to the healthcare system. RNAO has a signature program called the International Affairs and Best Practice Guidelines Center that develops, disseminates, implements, and evaluates clinical and healthy work environment best practice guidelines. The focus of our program is the newly revised and published Best Practice Guideline integrating tobacco interventions into daily practice. As part of our Tobacco Intervention Initiative, we hold regular webinars to support building capacity among nursing and other healthcare providers to implement and sustain best practices in regards to intervening with clients who use tobacco. Before we begin today's webinar, we like our webinars to be interactive and engaging. We encourage you to type in a question or comment in the chat box during our presentation. The last portion of the webinar will be used to address these questions or comments. We will also be archiving these slides on our tobacco-free RNAO.ca website, so they are available for future viewing. Today's webinar is in collaboration with the Canadian Cancer Society and will examine the effectiveness of the popular Run to Quit program. Here today to speak about the program is Kaylin Sutcliffe. Kaylin Sutcliffe studied health promotion at Laurentian University and continued her education completing her master's in human kinetics, focusing on clinical studies on environmental toxins. She has combined her love for physical activity and health promotion by working on several different community engagement projects that focus on increasing physical activity and access within communities. Kaylin is now a senior coordinator at the Canadian Cancer Society working on the Run to Quit program. Through this program, she is able to work on coupling physical activity with smoking cessation techniques. She works on the national program team and is the lead for Ontario engagement, Ontario program operations support, and evaluation support. Welcome, Kaylin. We are very pleased to have you here today to discuss the Run to Quit program. I will now turn it over to you to start your presentation.
Thank you, Nicole. I'm just going to open up my presentation. And thank you so much for RNAO for having us today. So some of you may have heard about Run to Quit before. It may have been in your communities last year. And I want to talk a little bit about what the program is, so just to recap in case someone hasn't heard about it before, how it works, and some of the research that we are conducting around the effectiveness and how the program helps support people to quit smoking. So Run to Quit is a partnership between the Canadian Cancer Society and the Running Room. And the program has been made possible in part by funding through the Public Health Agency of Canada. So it's being evaluated by the University of British Columbia as its potential as a chronic illness prevention tool. And our quit partner is McNeil Consumer Health, so McRett McAderm, who provide us some fantastic coupons and some samples for our participants who join the program. So quite simply, what Run to Quit is, it's a program that helps people quit smoking by learning to walk or run 5 kilometers. So Run to Quit is for all adults of all ages and fitness levels. It's a common misconception that people think they cannot do it, especially being a smoker. When you tell them that they need to run 5K to quit smoking, they might look at you like you have 4 eyes. But it is quite possible. And it is really for all fitness levels, and I really want to stress that. So in this program, we try to meet people where they're at. So whether they're walking or running, we meet them where they're at, and we try to get them to where they want to go. Whether they walk the whole time, walk the entire 5 kilometers, or if they want to learn how to run, we try to address their needs and be able to get them to their end goal. So why should people run to quit? So quitting smoking is hard. We all know that. And anything that can help in a quit attempt is highly valuable. Research tells us that using exercise and quit attempts helps in many ways. So in the project, we are encouraging people to take up exercise through walking or running to help them quit smoking. So the first reason that people should run to quit is walking and running can actually help cope with the discomfort and cravings while cutting down and quitting smoking. The second reason is that smoking has been correlated to low activity levels. So the idea is that the two, physical activity and higher smoking levels, go hand in hand. So if we increase physical activities, smokers will want to decrease or cut out smoking. So it's not just about quitting smoking, it's really about a lifestyle change. So as opposed to just helping someone become a non-smoker, we're trying to give them the tools to help them be a healthy, conscious individual, keeping in mind physical activity, nutrition, smoking, stress management, and so much more. So it really is about that lifestyle change. And the third reason is that it works. So the Run to Quit program builds on the success of a pilot project that we did in Ottawa. In the pilot project, we demonstrated that combining exercise and the support for cessation increases the chances of quitting by 7-fold compared to going cold turkey. By building someone's capacity to run or walk, reduces cravings and discomfort, while also they enjoy the benefits of increased cardiovascular capacity. So the pilot study posted a 28% quit rate among its participants 6 months after the end of the program. So like I mentioned before, the program is being evaluated by University of British Columbia. So after I go into some more details about what the program is, I'll go into some of our first-year results so you can have some context as to how the year went. On a more anecdotal side, many people and participants have shared their stories with us on how the program successfully helped them quit smoking. The first year of the program, 100% of people who have completed the in-store training program said they would recommend it to a friend, and many have become champions for the program going into year 2. So on my left-hand side of the photo, I have one of our past participants. Her name is Louise, and she's from British Columbia. And she identified herself as someone who would smoke her entire life. And her biggest fear as a professional and as a manager in her job was that quitting would make her frantic and emotionally out of control so that she wouldn't be able to manage her day-to-day work. So she used running to overcome her cravings. And she also went to her manager and told him that I might have problems, I might need to go for a walk during meetings, and any time that she wanted to grab a cigarette, she would go for a walk. So she successfully quit smoking last spring, so spring of 2016. She ran her first 5K, and then Louise went above and beyond. Starting off as a sedentary individual, she went above and beyond and ran her first half marathon in October. So these success stories have been overwhelming across the country. And one common theme of interest amongst all of these stories is that many participants had low confidence and doubt going into the program, but as it progressed, their confidence level increased, helping them to be more successful in the end. I'm not going to go into this in detail because I'm sure that most of us know that quitting smoking is the #1 best thing you can do for your health. And physical activity also protects us against many different cancers. It prevents, it helps us control high blood pressure, high cholesterol, type 2 diabetes, osteoporosis, obesity. So the two together, quitting smoking and increasing physical activity, is just such a great thing to pair together and to be able to help people prevent many of these different issues and health problems in the future. So how does Run to Quit work? So when people go to our website, which is runtoquit.com, or it's French, jecrois.com, smokers can either join our do-it-yourself program, which is absolutely free, or for extra support, they can sign up for a 10-week training program. The training programs come in 1 or 2 formats. So either there's a 10-week in-store training program, which is hosted at a local running room, or a virtual training program. So we do have in-store training programs at 10 locations this fall, and you can participate in virtual training programs or do-it-yourself from anywhere in Canada. So you do not have to have one close to you to participate. As you can see, the do-it-yourself is free, and the training programs do have a cost of $69.99 for the in-store training program and $49.99 for the virtual training program. The good news about the cost is that many healthcare spending accounts will cover the cost of the program, because it is a cessation-based. Also, the cost is very low when you compare it to many different 10-week training programs, especially since these groups meet 1 to 3 times per week. So you have a coach, a very small ratio of coach to participation, and you get the support throughout the 10 weeks. So it really is a great support system. So Run to Quit participants get support for quitting and getting active. I will go through each of the 3 streams so you can understand how they work, who they appeal to, and what type of support is offered throughout. So the first one is the in-store training program. So like I said, it's 10 weeks in duration. It costs $69.99, and the training programs are held once a week. So you actually have a class that starts with a 20 to 30-minute group seminar, and it's followed by a group walk or run. In the class, we cover many different topics, both cessation-related and then also run-related. Some of the weekly tobacco topics include goal setting. So we actually submit a goal or a quit date with everyone in the group so that everybody can hold each other accountable. We go over withdrawals and cravings, triggers, pharmacotherapies, stress management, nutrition, rewards, many different topics for both cessation and for running. We also have guest speakers who come in. So we have had nurses, pharmacists, many different people from the community who would come in and talk to people about these different topics and also share their expertise. So when people join, they get a lot of extra goodies as well. So they get the coach, they get the 10-week plan, they get a quit smoking guidebook from the Canadian Cancer Society, coupons for Nicorette and Nicoderm, and these are the highest in class, especially for in Ontario, where you get $10 off a Nicorette and Nicoderm products. And we also get trial offers of Nicorette gum. The running room will give them a technical running t-shirt on their first day, and they get a quit kit packed full of goodies, which is just a little fun add-on, and they get entry into our contest. So like I mentioned before, I just want to reiterate that anyone can do this program. So for the in-store training program, we do have recommendations for participants to determine if they are ready to start. If a participant can walk for 15 minutes or run gently for 1 minute, they are ready to go. We also do not put on emphasis on speed. So if somebody is going too fast and they won't be able to keep it up, we make sure they slow down, take a breather, so that they can continue to go and reach their whole 5 kilometers. A participant's pace should be slow enough to hold a conversation throughout. And just, again, I really want to reiterate that we do meet people where they're at. So we have groups, volunteers who will also walk with the slower people, and then other volunteers who will go with the faster participants as well. This year for the in-store training program, we also have another great addition. So we do recognize that fitness programs are always more successful when you do it with a friend. And that's why upon registration, we're offering the participants a 50% off coupon to invite a friend. You can invite a friend who is trying to quit smoking or someone who wants to learn how to walk or run 5 kilometers and support you to quit smoking along the way. Everyone is welcome. And last year we had a lot of people who took advantage of this without the 50% off coupon, especially inviting their family and friends to come join with them just so that they have an extra support network within the training program group. So the second training program type we have is the virtual training program. So these programs are ideal for people who wish to take a training program at their own pace and cannot attend one of the running room locations. Participants will get an online coach. His name is Steve, and they will also have access to an online dashboard. The coach will go through the same curriculum as the in-store program, and if anyone has any questions, Steve will be there to support. Online training programs are currently all the rage. With busy schedules, shift work, families, and non-ideal locations, many people opt for the virtual training program so they can do the program at their own pace and do it from anywhere. And they get a lot of the same things. So they get the coupons for Nicorette and Nicoderm, they get the calls from the quit line, and they also get entry into our contest. And all of this is on our website, which is runtoquit.com. So the third way people can join is do it yourself. And this program is 100% free. This program does not get the walk-run curriculum, but participants will be provided with some cessation support. And the program is ideal for people who feel confident that they can walk or run a 5-kilometer and might not need the additional, and might want some additional quit smoking tips. Participants will get emails, the quit smoking guidebook, coupons to Nicorette Nicoderm, calls from the quit line, and they will also get entry into our contest. So I have a photo here of one of our do-it-yourself winners from last year. So Jessica Therian was a do-it-yourself participant from Sudbury, Ontario in the first year of the program. So she joined reluctant that she could not commit to getting smoke-free. She was very reluctant, but she wanted to commit to getting smoke-free for her wedding. Jessica quit smoking, ran her first 5K, and has continued her healthy lifestyle journey since joining the do-it-yourself program, and to date has lost over 50 pounds. She achieved her goal before her wedding date and continues her healthy, active lifestyle. And she was also a $1,000 winner, so quitters can win in more than one way, both their health, and she was able to win a prize too. So the do-it-yourself program does work for many people. So you've heard me talk about our contest quite a bit, so I wanted to go over it in details and how it works. So this is our contest structure from last year. So the way it works is that we have 3 sessions that people can join every year. So we have a fall session, a winter session, and a spring session. When people go on our website and register by the deadline, they will be entered into our contest. When they quit smoking for 5 weeks, they will be eligible to win $1,000. So we recognize that quitting smoking is very challenging, so we want to be able to encourage people to quit and then also have the incentive with $2,000. But just like I mentioned before, it's not just about quitting, it's also about that lifestyle change. So we want people to go big and take the extra step so that they can win big. So when people stay smoke-free and walk or run in a 5K event by the end of spring, so last year was July 31st, they are eligible for a grand prizes. And last year we gave away a 2017 Honda Civic and one of 13 cash prizes totaling $16,000. So lots of really incredible prizes to give away, and especially when people are thinking about it but kind of on the edge, maybe a contest could entice them into making a commitment to quit. So this year, we're just in the process of confirming our grand prizes, so I don't have the schedule for the full year. However, our fall session is now open for registration, so people can go on our website, renttoquit.com. They can register before September 30th, and when they do, and they quit smoking for 5 weeks, they will be eligible for the $1,000. So we have, like I mentioned, in-store training programs at 9 locations this fall. We have the virtual training program and do-it-yourself from anywhere, so people can join that. Just like I mentioned before, you can do the virtual training program and do-it-yourself from anywhere. And next year, in 2018, we will be expanding the Rent to Quit program at 100 running room stores across Canada. So it's going to be our biggest year. Last year we were in, I think, 50 locations. So next year we're doubling, and we're going to be in all of the major city centers in Canada. So after participants go through their training program or their do-it-yourself program, they have to complete a 5K event. And they can do absolutely any 5-kilometer event that they want. However, we do have some that we have created in some of the major cities, and it's our signature event, and it's called Break Free 5K. One of the great things about this event is that it really brings all of the Rent to Quit participants together to do it for their first time, to complete their first 5K together. And it's really quite interesting to see so many people who've never ran 5K before all get together, very nervous about the whole experience, and be able to just feel so proud of themselves when they cross that finish line for the first time. So anyone is welcome to join. So if you're interested in attending one of our Break Free 5K events, we will be having some next spring. These are the 4 locations from last year, but we will be expanding in 2018. And it's a really great experience to see these people cross, so I encourage you to participate as well. So as healthcare professionals, I'm sure you have a million things going through your head at all times. And you want to make sure that you provide evidence-based cessation techniques and ensure that they work before encouraging your patients to join the program. So I have really great news for you. The program does work, and I have proof to back it up. Like I mentioned earlier, so the program is being evaluated by researchers at the University of British Columbia for its potential as a chronic prevention tool. So we have the principal investigator, Dr. Faulkner, and then we also have Carly Preeb, who's doing her postdoc research fellowship. I'm going to summarize their efforts for the year 1 results. Some of it's going to be through all 3 groups, but then after we're going to have a focus specifically on the in-store training program. So out of the people who registered for their program, here is the basic demographic of people we reached in year 1, and also who filled out the UBC questionnaire and surveys. So the in-store training program, we had 161 who completed the survey. 85% of them were daily smokers, 70 to 30 female to male ratio. The average age was 40 to 60, mostly Caucasians, and 70% of them owned their own home. In the do-it-yourself program, we see a similar mix, but we see a younger demographic, and maybe with a lower SES, is less owned homes. So it's important to note that for this group, they could also register between January and end of April. So by the time we submitted the baseline surveys, some may have already quit smoking or have cut back. So that could explain the 46% daily smoking status at the beginning. And the virtual training program, again, we see very similar results to the in-store training program. So one of the questions that we ask participants is how did they hear about the program? So for both do-it-yourself and the virtual training program, it was no surprise to us that the highest way that they heard about it was from online ads. These people are already online, so why not join an online training program or a do-it-yourself program that's mainly based online? The in-store training program, our highest number of people who found out about it was from friends and family. So we really worked a lot with the Running Room and Canadian Cancer Society to encourage people to join. So we're kind of preaching to the converted already, so many of them know people who smoke, and this is a great way to hear about it as well. They know that the Running Room is a great place to join. They know the friendly atmosphere, so when they tell people about the program, it resonates more. What's interesting in this mix is that less people heard about it from their healthcare or service providers, although the majority of participants said that they want to hear about cessation from them. So this year we would like to try and shift the needle in this area and have more healthcare providers encouraging registration into the Run to Quit program. So these specific results pertain to the in-store training program. So to evaluate the program, a mixed method approach was used to assess the effectiveness of the program in assisting individuals to quit smoking and become more active. Participants filled out a questionnaire to self-report their physical activity level, running behavior, smoking patterns, group cohesion, and smoking identity. So the questionnaire was completed at week 1, week 3, and week 10 of the in-store training program. Participants also had their carbon monoxide levels tested using a smokalizer at week 1 and at week 10. This tool was very interesting because not only did it give an objective measure, but it also seemed to act as a motivator for some of the participants. Some of the coaches reported that participants wanted to see their levels drop, so they used the smokalizer more frequently to kind of gauge their progress throughout the program. Other measures that we had include coaches' logs, attendance trackers, follow-up phone calls, and then also 6-month follow-up phone calls with both participants and coaches. So these are the results from both the smokalizer test and the run frequency. So one of the great things that we could do in the in-store training program is actually take carbon monoxide tests at week 1 and 10. So over the 10 weeks, we did see a significant decrease in carbon monoxide levels from baseline. We also saw moderate and vigorous physical activity minutes increase significantly, and quite substantially as well. So they went from 190 minutes to 244 minutes a week. So in this slide, we do see that there was an attrition rate for the training programs. And when comparing it to other training programs, when speaking with the running room, they said that it is common to see a drop-off rate throughout. So people do get busy schedules. The program might not be for them. So we did see a 42% attrition rate. In this chart, though, we can see that the number of daily smokers from baseline to week 10 did drop from 85% to 34% from week 1 to week 10. We also see participants cut back on smoking, and many quit smoking altogether. So with a full group, the intent to treat overall was 23%, which we're really quite excited about. Above and beyond, we asked people who completed the in-store training program a few other questions. 100% said they would recommend the program to a friend or a family member who was thinking of quitting. 97% reported it was beneficial or very beneficial for increasing physical activity. 92% reported it was very beneficial in helping them quit smoking. 91% reduced their smoking as a result of the program, and 51% said that they quit smoking altogether. So after the 10-week training program, the UBC team wanted to follow up with participants at their 6-month mark to see if the quit stuck. So we know that quitting smoking is hard, but staying smoke-free is even more challenging. So at the 6-month mark, 39.8% of participants who completed were still smoke-free, and 28.4% said they were smoke-free and had not even taken a puff since quit week, which was 6 months prior. So we're very excited with these results, especially since how challenging it can be to stay smoke-free for such a long duration. Physical activity increases at the 6-month mark were just as impressive. So 6 months after the 10-week training program, 43% of participants were still running an average of 3 times per week. And this is very impressive compared to baseline, which was 0.27 times per week to start. So some additional results. I mentioned this before, so confidence level and shifts in identities were also evaluated. We did see that at week 3, confidence to both quit smoking and run a 5K by the end increased. Participants reported a shift in their identity from baseline to the end of the program, with the measure of runner identity increasing significantly and the identity of being a smoker decreasing significantly. And qualitative results from coaches and participants interviews reinforced this finding. And I really like this quote from one of the participants who said, "I've always wanted to be a runner and not a smoker, and thanks to this group, it is a reality. I'm a healthier person." So I was talking to Dr. Preeb the other day, and we're really excited about these results. And she had an announcement that in September, an article with the final results from the study are going to be published. So look out for those when they come. And there's a lot of other great information throughout that article about other points that we were able to assess. So we actually just finished our 2nd year of the program, and Dr. Preeb also mentioned that the results for year 2 are now coming in. And just a little bit of a teaser, but it does look like the quit rates are much higher in year 2 than they were year 1. So as a team, we really tried to refine the program, see what we can do better, and we did see a higher quit rate because of it. So we're very, very excited about those results. And the other thing is that we were also able to attract more participants. So we had more people year 2 and a higher quit rate. So we're looking forward to see the 6-month follow-up to see if it's on par for being similar to year 1. So how can I tell my patients about the program? So now that you know what Run to Quit is, and now that you know it works, you're probably wondering how you can tell anyone about the program. So we value your voice and recognize the importance of healthcare professionals in helping us spread the word about Run to Quit. We would love for you to simply talk about it and recommend patients to give it a try. You can easily refer them to our website, which is runtoquit.com, or in French, jecourgeclasse.com, for participants to register. In 2016, we conducted a short survey, and we sent out an email to a bunch of databases that work with smokers. Overall, we had 689 respondents, and these weren't necessarily, these were not people who registered for the Run to Quit program. We asked them where they were looking to, where they would look for advice to quit smoking, and 42% said their doctor or healthcare provider. So this shows that many people rely on the expertise and advice from their doctors and healthcare professionals to talk to them about smoking cessation techniques. This year, we'd really like I mentioned before, to just rally the healthcare professionals to support the program, talk about it with your patients, and use this as an option to help them quit smoking. One way that you can promote Run to Quit is by handing out our materials and resources. So we have created quite a few resources, and we really want to get this material as far and wide around communities to get the word out to as many people as humanly possible. We want to engage smokers to make a healthy lifestyle change and to take the first step by joining the program, and we cannot do this unless we're seen. Our posters this year play an intrinsic motivation that people have to quit smoking. We have a group shot of our participants and a testimonial from our participant, Carolyn. So she quit smoking so she could break the cycle in her family and so her son wouldn't starve. On the right-hand side, I have an example of a tear pad sheet. So this tear pad sheet is specific to provinces that have smokers helpline, and we have other ones for the other provinces. So Smokers Helpline has another contest. It's called First Week Challenge. So when people register for First Week Challenge, they're increasing their quit attempts. And when they quit for the first week of any month, they have a chance to win $500. And the great thing about both these contests are both have the incentive to register for a program, but you don't only have to do one. So you can actually register for both contests and still be eligible to win the prizes in each. And the one that's specific to the Run to Quit program is similar to the poster that we have on the left-hand side. So tear pads come in sheets of 500, sorry, it's not 500, 50. They come in sheets of 50, and they really are a great way to give a prescription to quit. So it's a little tear pad. It has the website on it. Check out this program. So that's how they're meant to be used. The last handout we have is our Run to Quit information sheet. So the information sheet is a cheat sheet with all of the relevant information about why a program is best for the patient. It explains what is Run to Quit, how it works, the ways to join, and how to learn more. So visiting runtoquit.com. So no matter what resource you're using, your own voice, one of our posters, the information sheet, we are really asking everyone to go to our website to learn more about the program. The website is full of great information about Run to Quit. It clearly explains what it is, the benefits of the program, what to expect, and it has success stories from previous year's participants. We also have a help button on the site, so if anyone has any additional questions, they can connect with us at any time, and we will be more than happy to support them throughout. So how can you get the resources? The resources are absolutely free, and we can mail them to you. All you need to do is email runtoquit@cancer.ca, send me your shipping address and quantities, and I will be more than happy to send you the requested materials. Each province also has a designated lead. So I am the lead for Ontario, along with my coworker Karen Kuzmich. And I know we may have some representatives who are not from Ontario, so if you email us at runtoquit@cancer.ca, we will facilitate an introduction with your appropriate provincial lead. So if you ever want to do more, or if you have any questions, you can always email them and they'll help support you. I also wanted to clarify that although this presentation is for RNAO, we do have resources for different purposes and anyone can order. So we have, we did a workplace promotional campaign for one of the hospitals last year. We also did school campaigns. Someone last year requested a car decal for a street sweeper. So anything that you have an idea or if you have any connections, please let us know and we can try to accommodate that kind of promotional resource for you. So I also want to share some additional resources. So just like I mentioned, I worked for a few hospitals last year, did some work with us. And one of the hospitals had a database of people who were smokers. And what they would do is they would ask people to opt in, and they would send them newsletters. They had a website, and all of these additional things that people can find out information about cessation. So I want to let you know about a few other resources that we have that are pre-created that people can use. So the one on the screen is just an email blast. So we have quite a few email blasts that you can send out to whoever you think might want one. So that's the first example. The second thing is a link on your website. So a lot of public health units and hospitals will have a resource section, and it'll mention quit smoking resources or quit smoking websites. And Run to Quit has been featured on quite a few of them. And the really great thing about this is it actually works. So I can track how many people have clicked on that link to ensure that people are going to the site on whatever public health unit and clicking through to runtoquit.com. And when it's there, people are clicking. So it does work. So if you're able to do that, we can provide you with the link, and we can also provide you with any artwork that you might want if you want something a little bit more fancy on your website. We also have banners, so I have my email signature where I put a banner on it with a link to the website. So that might be a useful way to promote the program as well. Another way that people can promote is through social media. So we've created a social media toolkit that provides resources and visuals for you to share Run to Quit on your social media channels. It also provides instructions on how to follow us. So we're both on Facebook at Run to Quit Canada or Twitter at Run to Quit, and background information if you would like to create your own post about Run to Quit. If you don't have time, like many of us don't, I have created pre-drafted posts with photos and videos that you can use, and I encourage you to share on your site. So if you want any of these resources, you can again email us and we'll help facilitate where to find them. So runtoquit@cancer.ca, or we have a website with all of these resources already housed. So you can go to the FTP site, which is ftp.cancer.ca. It is password protected, so username is challenge, and the password is Legion2014. And then you just click on Run to Quit, and all of the resources will be available there. So overall, our goal this year is really to engage communities to take part in this program and bring people through the Run to Quit journey. The three ways I outlined, talking about the program with your patients, handing out materials, using our digital resources, are all simple ways that you can promote Run to Quit. I'd like to encourage you to use these options that you think works best for you. And we're really excited about the future of the program. We know that it works, so we're excited to get a large number of participants in and see the effectiveness of the program in 2018. Thank you again for allowing me to present today, and I'm going to pass it back over to Nicole for some questions.
Okay, thank you, Kaylin. That was a wonderful presentation. So we'll now take some time for questions. A reminder that if you have any questions for Kaylin, you can type them into the chat box that you can see on your screen. So we do have one question to start off initially, and the question is, since we know that smoking rates are higher in some structurally disadvantaged populations such as Indigenous, LGBTQ, and those with low SES, is there a way this program would address this or reach these populations?
Yeah, so that's a really great question, and I think that we're always trying to look for how to work with these different groups. Last year, I worked a lot with the different community health centers, and they have a lot of programs within their facilities already that address smoking cessation. So a lot of them had their own walking groups, and what they ended up doing is that they incorporated the contest so that they can encourage people to join there. We've reached out to, had attendance last year at Pride, so trying to reach out to those populations. And then also for, sorry, what was the third group that they were mentioning? Aboriginal populations. Is that what it was, Nicole?
Correct.
Okay, so what we did was we actually worked with a lot of the friendship centers last year, and we presented the program to them. We had a few that promoted within their communities, but a few that, like most Aboriginal projects, is that they kind of want to do it their own way. So one group in Thunder Bay ended up having their own contest, and then they incorporated the Run to Quit contest with it. So I think they had a walking challenge with Fitbit, and they could win an ATV, and at the same time, they encouraged them to follow the guidelines that were associated with the Run to Quit program to give them that extra incentive to quit smoking. So it really is, I guess, unique to all of the different provinces, and what we're trying to do is look for those opportunities where we can and be able to partner with different groups so that they can help promote the program. Does that answer the question?
Kaylin, we can go on to the next question, if that's okay. So we have a question from Patricia. She's an RRT in Fort McMurray. She just wrote, "Hi, my name is Patricia. I'm an RRT in Fort McMurray. I run a pulmonary rehab program here in a rural community. One of the focuses of our program is helping people increase quality of life with COPD. So we have patients that are currently smoking once they start the program. I'm interested to see how we can involve Run to Quit as a tool to help her patients quit smoking, and wondering if you have any advice."
Yeah, so the person in Alberta that manages the program is Kristen Berry. So if Patricia emails runtoquit@cancer.com, I can connect her. She'll probably want to learn a little bit more about what the program is, the timelines, the structure, and then kind of try to figure out what would work best for them. Last year, what we ended up doing too is for some specific groups, we would have kind of like a group session. So I worked with one place in Midland and Penetanguishene that didn't have a Run to Quit program. So what they ended up doing is they rallied together through their public health unit. They found a coach who would be interested in having their own session, and they registered for the virtual training program all together, and then just had meetup walks and run groups. So that was one way that we kind of changed the program just a little bit in order to make it fit their needs. So there are those opportunities in different locations. Specifically for workplaces and some community groups, if you can get a large enough group out, the Running Room this year has agreed to make a unique training program online for that group. So I think the minimum number is 10 people. So if you can rally up 10 people, then they'll be able to facilitate that for you. But Kristen would definitely be able to support to figure out what works best for your needs.
Okay, Kaylin, I'll read the next question for you.
Okay.
So Fabiana said, "Hi, thank you for all this great information. I am a tobacco treatment specialist in Colorado, USA. I was wondering what you include in the Quit Smoking Kit."
Yeah, so the Quit Smoking Kit, so we have the guidebook from the Canadian Cancer Society, and here we really try to promote the 4 Ds. So drinking water, delay, distraction, and do something. That's how we kind of adjusted it a little bit. So for drinking water, we provide everybody with a water bottle. For distraction, we provide everybody, the first year it was a stress ball. This year it was something called a tangle, which just distracts them whenever they want. And then we also had the Nicorette sample, so that when people had a craving, they can use the Nicorette sample instead. And then doing something was just about getting active. So we had kind of like a little cheat sheet of the 4 Ds, the guidebook, and then those resources so that they can use them whenever they want, and they can help them quit smoking. So that was really the contents of the Quit Kit this year.
Okay, and then we just had one question for RNAO, and that was how to obtain a certificate of attendance after the webinar. And so just so everyone knows, you will be emailed an evaluation within 24 hours of the end of the webinar. Once you complete the evaluation, you will receive a certificate of attendance. And then another question for you, Kaylin. There were just some people who were wondering if this was the same program, perhaps with a different name, or if you're affiliated with the Run, Quit, Chill program that's offered by Leave the Pack Behind for youth.
Yeah, so the Run, Quit, Chill program is a little bit different, and we do work very closely with Leave the Pack Behind, and they promote our program on campus. And then we also promote their program to a lot of our clientele that might not be on campus, but fits their age demographic. So it is not the same program, but the Kellyanne Lawrence is the one who has helped start that program and support it. And she's actually been a support network in helping us create the Run to Quit program. So Run to Quit, if you want to join the contest, you have to be the age of majority. And I think with both Run, Quit, Chill and Leave the Pack Behind, what they found with that specific demographic is that they really want advertisement that is geared to them. Our advertisement is a little bit more broad, and I think that's why when we're promoting, we're really attracting that anywhere between 40 to 60 tends to be the average demographic. We have people who are on the lower age scale, but really that is the main demographic. So I think Run, Quit, Chill really focuses on university, college students, campuses, and really promotes to that demographic using visuals that appeal to them.
Okay, Kaylin, and there was just another question asking if you could repeat the username and password to receive the resources.
Yeah, so let me go back. So it's just on the screen right now. So FTP, oh, sorry, it just went away. So ftp.cancer, sorry, I don't know what's going on here.
I think she's trying to switch the slides.
Oh, are you trying to move the slides? There we go. ftp.cancer.ca is the website, and the username is challenge, and the password is Legion2014. So this is the specific FTP site is also owned by Smokers Helpline. So if you're not within a province, you can still go to that has Smokers Helpline. You can still go in and use the Run to Quit resources. But if you are interested in First Week Challenge contest, they also have the resources for First Week Challenge contest housed on this site as well.
Sorry, Kaylin, which slide did you have that posted on? Just because I think the slides aren't transferring the same way.
Oh, they're not? It was the second last slide.
The second last slide.
So there's 38 slides, and it should be on slide 37.
Okay, so we'll leave that posted for a little bit. And just going to see if anyone else has any more questions. And people are posting that they got the information as well.
Perfect.
Okay, perfect. I don't think anyone else has any more questions. So thank you, everyone, for participating in this webinar, and thank you again, Kaylin, for coming and doing this wonderful presentation. So just so everyone knows again, all the webinar participants will receive an email from RNAO within the next 24 hours. It will link you to a short evaluation survey for this webinar. Once you have completed the survey, you'll be able to print a certificate of completion. And we hope that you will all be joining us for our upcoming webinars. Just so you know, we have one on October 3rd, and we'll address the application of tobacco interventions into acute care settings. And this will prepare you as Ontario moves towards smoke-free hospital grounds that are going to be effective on January 1st, 2018. And just for please to everyone, visit our tobacco-free RNAO website for more details. Kaylin, is there anything that you would like to add?
No, I just wanted to thank you so much for giving us this opportunity, and thank you for everyone attending the presentation.
Okay, everybody have a nice day.